Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and let's look at today's top health news. MTaI urges the government not to levy TDS on free medical samples to doctors and clinicians. The Medical Technology Association of India, which represents the leading research-based medical technology companies with a large footprint in manufacturing, R&D and healthcare worker training in India, has urged the government to reconsider its recently introduced tax deducted at source provision on free medical samples provided to the doctors. Taxation on these samples will adversely affect the hands-on training for doctors and clinicians and therefore impact patients' access to life-saving and life-enhancing technologies. The MTaI has also urged the government not to consider the expenses incurred on doctors' trainees, travel and stay for product training and application usage as doctors' income because they are often required to travel mainly due to difficulties in mobilizing medical devices and equipment. Thus, TDS should not be levied on such expenses. As per the provisions, free medical samples provided to doctors, reimbursement of out-of-pocket expenses incurred by healthcare professionals, and expenditure pertaining to dealer or customer business conference would be treated as a benefit and therefore be subject to TDS deduction. Pawan Chaudhary, the Chairman and Director General, the Medical Technology Association of India, MTaI, said that medical device samples are central to providing hands-on training to doctors and clinicians in vivo and in vitro, and sometimes to even demonstrate to patients on how the procedure will be carried through. Any taxation on samples will prohibit these activities and hinder the doctor's ability to deliver an optimal patient outcome, which will impact the patient's access to life-saving and life-enhancing technologies. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.